Thousands of years ago, headaches had a cure. A hole drilled straight into your skull. Not with medicine, with a stone tool. Imagine a pounding, unbearable headache. Now imagine this was the treatment. Archaeologists keep finding skulls exactly like this. Thousands of them, on nearly every continent. And there's a surprising detail waiting. If you're enjoying this, hit like, subscribe, and comment. Did people survive this? Did it work? And there's a twist still used today. This procedure has a name: trepanation. One of the oldest surgeries ever discovered. Older than writing. Older than metal tools. The idea sounds unbelievable today. Cut or scrape a hole in bone into a living person's skull. Somehow, this became common practice. Practiced by cultures who never met. The title asks about headaches specifically. Ancient people suffered brutal migraines. Without medicine, pain like that felt inexplicable. Terrifying, with no clear explanation available. A hole in the skull promised relief. Sometimes, that relief may have arrived. Trepan skulls turn up across the globe. In Europe, buried beneath ancient farmland. In South America, high in the Andes. In Africa, among very early communities. Across islands scattered through the Pacific. Different continents, different centuries, same idea. Nobody taught these cultures from each other. They arrived at trepanation independently, repeatedly. Picture a world map dotted with sites. Each dot marks a skull with a hole. Some sites date back 10,000 years. That's before the invention of writing. Before farming, in some regions. Yet they mastered a delicate skull surgery. Consider that for a moment. Curiosity and medical skill, ancient. Humans have tried to fix pain. That drive, it turns out, is ancient. They had no metal drills back then. Just sharpened stone, flint, and obsidian. Some healers scraped the bone away. Others drilled small, overlapping circular holes. A few cut a square section. Every method aimed at the same goal. Remove bone. Leave the brain untouched. A steady hand mattered enormously. Infection was the real, constant danger. One wrong move risked infecting the brain. Healers likely used plants as antiseptics. Trial and error, building real expertise. Picture yourself as a patient back then. No anesthesia exists yet. None at all. Herbs, ritual, maybe alcohol, dull the edges. A trusted healer kneels close beside you. This isn't panic. It's careful, practiced work. The healer has likely done this before. Your survival depends on their steady skill. Fast forward to the 1860s, in France. A doctor named Paul Broca grew curious. He studied hundreds of ancient trepan skulls, examining each one under a microscope. He was hunting for one specific clue. Proof of what happened after the surgery. What he found changed everything. Around many holes, he noticed something odd. Smooth, rounded new bone, growing inward. New bone only forms on living tissue. Dead patients cannot grow new bone. Ever. Which meant something remarkable. These patients survived. Not for minutes. Often for years afterward. That's the surprising detail from the beginning. Ancient skull surgery wasn't a death sentence. Some skulls show several healed holes. One person even survived it twice. Broca had proven something extraordinary. Stone Age surgeons weren't reckless, careless butchers. They understood anatomy to keep people alive. That discovery reshaped how historians saw them. But surviving surgery is one thing. Did the procedure actually help anyone, though? Why would ancient people even attempt this? The answer's split into two clear categories. First, spiritual beliefs, held deeply. Some cultures blamed evil spirits for headaches, or for seizures, or fits of madness. Healers believed something harmful was trapped inside. Drilling a hole let that spirit escape. In some regions, shamans led the ritual. Chanting, drumming, or herbal smoke accompanied it. The spirit, they believed, needed an exit. To them, This felt like sacred medicine. A ritual act, not random violence. The whole community witnessed the ceremony. Second, a practical explanation existed. Imagine a warrior struck hard during battle. His skull cracks under the blow. Blood and fluid pool beneath the bone. Pressure builds inside the injured head. Ancient healers noticed something crucial. Releasing that trapped pressure seemed to help. So they opened the skull on purpose. That instinct, it turns out, was sound. Modern doctors recognize this same logic. Reducing pressure on an injured brain. Trepanation treated more than headaches. Seizures, chronic pain, and skull fractures. Anyone with sudden, violent head trauma qualified. A fall from a cliff. A war wound. Whatever the ancient diagnosis, pressure was suspected. And relieving pressure, medically, makes sense. Modern doctors would recognize that logic. Centuries later, ancient Greece documented it. Hippocrates, called the father of medicine. Around the 5th century before our era. He wrote surgical instructions for head injuries. Exactly where a surgeon should drill. How deep to cut. When to stop. He warned against certain risky spots. He specified instrument types and cleaning steps. Even ancient Greeks understood cleanliness mattered. This wasn't superstition to Hippocrates. It was careful, reasoned, deliberate medical practice. Trepanation had entered serious medical writing. His surgical texts guided doctors for centuries. Physicians across the Mediterranean studied it. Trepanation became an accepted surgical option. Not folk magic, actual documented medical procedure. That distinction mattered for medicine's future. Ancient superstition and ancient science, blurring together. Travel far away, to ancient Peru. High in the Andes Mountains, centuries past. Peruvian healers performed trepanation more than anywhere. Thousands upon thousands of skulls survive. Preserved well in dry mountain soil. A near-perfect record, waiting to be studied. A modern researcher named John Verano studied them. A bioarchaeologist at Tulane University, examining bone. He tracked skulls across many centuries. He wanted one number, the survival rate. Early skulls showed rough, uneven surgical technique. Later skulls told a different story. Something had improved, generation after generation. Survival rates climbed across the centuries. Early on, half the patients survived. Later Peruvian surgeons reached something astonishing, 80%. Some estimates pushed toward 90% survival. No anesthesia, no antiseptics, no modern sterile tools. Just accumulated skill, passed down generations. Peruvian surgeons used sharp obsidian and bronze. Some skulls show up to 7 holes. One skull had survived 5 surgeries. So yes, it worked, and it kept improving. That's centuries of trial, error, and skill. Surgical technique kept getting more refined. Peru ran a centuries-long medical experiment. And here's a twist worth sitting with. Doctors today perform a version of this. Not folklore, not history, right now. In hospitals, this week, somewhere nearby. Fast forward again, to a modern hospital. A patient arrives with severe head trauma. Maybe a car accident or a bad fall. Their brain begins swelling inside the skull. Pressure builds, like that ancient battlefield wound. Doctors need to relieve that pressure quickly. The procedure is called decompressive craniectomy today. Surgeons remove a section of skull. Temporarily, to give the swelling brain room. It's a recognized, modern neurosurgical procedure. It saves lives after severe brain injuries. The bone is stored safely, then replaced later. Once swelling goes down, healing continues normally. Modern imaging shows doctors where to operate. Recovery, today, is closely monitored. Sound familiar? It's the same core idea. Relieve pressure, open the skull, save someone. Ancient healers had no word for pressure. No scans, no imaging, no medical theory. But their instinct pointed toward something real. That old idea never disappeared. It kept evolving, century after century. Stone tools became steel. Ritual became protocol. The core logic stayed unchanged. Zoom out for a moment. See the timeline. Prehistoric healers, drilling with sharpened stone tools. Hippocrates, writing precise surgical instructions in Greece. Broca, finding proof of survival, centuries later. Verano, tracking survival rates across ancient Peru. And now, modern neurosurgeons, in operating rooms today. One thread, stretching across 10,000 years. The same idea, refined again and again. So here's what modern research proved. Broca showed bone regrowth. Many patients survived. Verano showed survival rates climbing toward 90%. And doctors today still use this idea. 3 mysteries, each with an answer. Ancient curiosity was onto something. Not blind superstition, actual careful medical reasoning. Humanity's first working surgery might be this. You started this video wondering about a hole. So picture that hole in the skull again. Not a barbaric mystery, not senseless violence. A frightened patient and a steady-handed healer. Working with the only tools they had. Thousands of years before modern medicine existed. That radical ancient cure often worked. And it's a distant ancestor of surgery today. Surgery that, right now, still saves lives. Headaches, it turns out, had a real cure.